Howdy, everybody. Welcome back to the Hotspot. Joining us live in studio is a dear friend I haven't seen in how many years?
Right.
Former Senator Dennis Rodriguez Jr. to talk about his new role as the Leon Guerrero Tenorio administration's new chief on health care, right? Chief of health care?
An advisor to the governor on healthcare.
Almost the same
Yes.
thing, right? So tell us about this new role and how this all came about.
Yeah, well, first of all, really want to thank the governor, lieutenant governor, for the opportunity to work with them and to work with the administration to be able to address something very important, which is the health disparities of our people, a lot of our people. And, this is some of the work we've done in the legislature when I was had oversight of Committee on Health. And when I spoke with the governor, this is her mission, is to be able to provide better services for our people. And if not for the pandemic, I think you would have seen more progress. But now, as we're making that turn, I think a lot of focus and attention will be made on this to ensure that our people are have access to care.
And I think the issue with healthcare disparities, it was kind of brought to light really when the CDC, Public Health, they did their study on the COVID-19 related deaths from last year.
That's
and in
right.
that report, there was a lot of data on a lot of the deaths were connected to lack of access to health care. They didn't have insurance and things like that. So how do you plan on addressing all of that?
Yeah. So, we're going to work with the progress that's been made already. The administration, and I'm starting to speak to those who have been working very hard to get us to where we're at today. We're going to pick up from there and just move forward with guidance from previous legislations, from the previous legislatures that have put framework in place to expand health insurance coverage for our people. And so that's the focus that we'll be really working on with public health. And ensuring that right now, as we work on that, the administration has this Operation Homebound,
Yes.
and they've been able to really see the effects out in the community where people, they go out for COVID-related, shots. They have their eligibility specialists out there, but they've seen the great need of our people. And so we're going to do more of that. The governor wants to make sure that we go out to the community, to the people where they're at. And so we're going to make sure we do that.
Right. And, in Operation Homebound, it was kind of born from the point in time, the homeless count. And I remember watching one of the briefings, and a lot of the participants were kind of shocked, and about what they saw, people who were living in substandard conditions. And this is kind of the population that you guys are going to be targeting.
That's right.
And tell me about the work of Total Guam, because that kind of relates to what you're going to be doing, right?
Yeah. So, the Total Guam Foundation was born 5-6 years ago, when as the oversight chair on health, we saw this is an issue. Our people don't have access to care. And even at that time, as a senator, we knew that the government can't do everything, can't provide everything. And so, my wife and I co-founded the foundation, where we brought people together, doctors, nurses, together to be able to provide their time to volunteer. And so we, very successful. We serviced over 5,000 individuals in the community since then. So we're going to use that same kind of model, bring the whole arm of government together, at the direction of the governor, lieutenant governor, to be able to get the people the services they need out in the community. And so, now with the increase in Medicaid funds compared to the time I was there, I think it's just about time to be able to leverage those resources to not just provide the services today, but to ensure that there's sustainability moving forward.
5,000 people, that's a lot of people.
Yeah, that's through borrowed time and through volunteers.
So having been on the front lines through Total Guam, how does it affect you, I guess, personally, when you see so many people that don't have access to health care, that need these services? I mean, it's got to, affect you.
Yeah, no, it really does, and it pains you. When you see a family of 5 or 7 kids, I've seen that don't have access to care, but then have to come and line up at these outreaches that we have, and after they're done with that, the doctors, the providers tell us, they need more. It's not just the medical care that they got that day, but there's behavioral health issues, there's dental care issues, there's eye care issues. And so with that knowledge now, and working with, now in my new role with the governor's office and the full support of the administration, I think you'll see a lot more progress in that front.
So this is going to be sort of an extension of Operation Homebound, but providing more sort of wraparound
That's right.
services?
That's right.
Okay.
Yeah, and so, especially with the lieutenant governor, he's very, he wanted to ensure that we have that system of care approach and that whole wraparound that you've talked about, and ensuring that when we go out, it's not just for one service, because we know that our people who are in this, who are in this social, economic, and environmental disadvantage don't just need one service. There's so many other services that now we have the full government being able to support them.
So are you going to have, I guess, an office at Adelup? How are people going to be able to?
Yeah, so I'm working out of Adelup. We'll be working with public health very closely, but we're working with Guam Behavioral in the hospital as well. But if they know me, my numbers never changed, so they can call me.
All right. Well, thank
Great.
you so much, Senator, for
Great,
coming
thank
in and
you.
talking with us. Any final comments you wanted to make?
No, just that we're going to work very hard. We're going to ensure that the vision of the governor, lieutenant governor, to address the needs of those in the community are followed through. And so we look forward to delivering the service.
All right. Thank you so much.
Great,
I know
thank
you've
you.
got a lot of hard work ahead of you.
Thank you very much.
Stay
Great.
tuned. The Hotspot continues after the break.